Clear. Uh, this method, which is promoted by you and Dr. Neil Bernard, as we have experienced that it works every time the patient are convinced about it and they follow the diet, they are able to recover from the disease, they are able to recover from the drugs, as well as they are free from the doctor's clinical visits. They are totally healthy again. My question to you, in spite of getting a total benefit from the diet, why it is not promoted? Why only few people know about it? Or what we can do
Right,
to promote it?
right. Really, really good question. I think there are several reasons. One is that physicians here in the U.S. do not get any nutrition education in medical school. I think I had maybe one class that was 2 hours where they talked about very basic nutrition, but Western physicians, we really don't understand how nutrition affects health. And so when we have a patient in our office, we feel very uncomfortable advising them about nutrition because we don't feel qualified to do that. And I think that's a huge area that we really need to work on, and that's a huge gap. When our medical providers and physicians are not educated in nutrition and don't feel comfortable advising their patients, then the information is not getting out there. Another issue is that there is so much conflicting information about nutrition. Lay people are really starting to kind of interpret research in their own ways and maybe not necessarily understanding how to analyze published research, but the media here really loves big buzzword headlines. And so they'll interpret certain research studies that will say, don't worry about saturated fat, you need to worry about carbs. Oh, forget carbs, you need to worry about fat. Paleo diet is the way to go. And then so there's so much conflicting information. People don't know what to believe. It's hard to research nutrition. Really, we have a very reductionist point of view here in this country where we'll say, let's just look at vitamin D, and if it's high or low, then it affects health, X, Y, and Z ways. We don't look at, in general, how are all the nutrients working together in this very complex system. What diet patterns in general should we be following? We get very stuck on tiny little details and looking for the magic bullet. If we just raise vitamin D, everything will be okay. But that's not how nutrition works. So I think physicians are not properly educated and they don't feel comfortable advising their patients. There's a lot of confusing research and information and advice about nutrition, so nobody knows what to believe. So I think people are afraid, physicians are afraid to make those recommendations because they don't know, what research to quote, or there's conflicting research out there. And I think there's personal